there's a bunch of companies trying to integrate GLP-1 receptor agonists into their nutritional platforms or their coaching platforms, because they're very effective for weight loss. I think we're gonna towing a fine line of like the safety of this, because when any medication gets prescribed in mass quantity by non-experts, like there's obviously potential safety ramifications for that.
Hey everyone, thanks for being here. Today I'm really excited to talk to Dr. Arti Thangudu. She is the CEO of Hey Healthy. She is also a board certified endocrinologist and diabetes expert. Hey Arti, thanks for being here.
Thanks so much for having me, Saya.
So before we start talking about GLP-1 receptor agonists, I just want to get a little bit of information on what Hey Healthy is so our audience knows your background.
Yeah, Hey Healthy, we're rebranding our company to Hey Healthy, and we help self-insured businesses who want to save time and money on employee health care by providing accessible, supportive diabetes and endocrinology care to employees so they can be healthy, stay out of the hospital, and have renewed energy and productivity.
And why is this great for employers?
Because patients who are sick with diabetes and endocrinology conditions have a lot of trouble getting into endocrinology because there's so few of us. There's only 5,000 endocrinologists, and there's 37 million people with diabetes. So access is a huge issue. And also cost of diabetes is super, super high when patients get sick from preventable complications. So we try to keep their patients and employees out of the hospital to save them on cost as well.
So if someone's watching this and wants to get in touch with you about your solution, what's the best way to reach you?
They can reach us in a couple of ways. You can email us at hello@essaycomplete.com or just DM me on Instagram. It's Dr. Arthi Thangudu, just my name, DrArtithangudu.
Awesome. All right. So I am so excited to talk about this because I have so many thoughts and I'm very interested in hearing an expert's opinion. When GLP-1 receptor agonists hit the market, obviously they caused a crazy amount of buzz and people were excited, people were nervous. So before we get into all the questions I have about it, what is a GLP-1 receptor agonist and why do people use them?
Yeah, so I have a lot of thoughts on that, so we'll get to that. But GLP-1 receptor agonists are medications that were originally used for diabetes, and they work in a few ways. So they're injectable medications. The first ones were once a day injectables. Now most of them are once a week injectable medications, and they are an agonist, so they kind of increase the activity of a hormone that's naturally produced by the intestines called GLP-1. This is an incretin hormone, and it affects a couple of things. One, in patients living with diabetes, it causes them to secrete more insulin in response to a meal. So if their blood sugars are going higher because of a meal, the pancreas secretes more insulin to help bring those blood sugars down. But they can also be very effective for weight loss because GLP-1 also slows down how fast the GI tract moves, so people feel full on less food, and also works on brain receptors to decrease food fixation. So people with overweight, obesity, diabetes, they talk a lot about something called food noise, that they're thinking about food all the time. So these medications actually help with that as well.
And I have also heard that they might help with reducing alcohol consumption. Is there any studies on that, or is that just something that people have been noticing as a trend?
So we see it in some patients. What I've seen in my patients who do struggle with alcoholism is that it does have somewhat of an effect early on. But as we know with addiction, there's a lot of dopamine issues, and these medications don't really play so much on dopamine. So what I've personally seen clinically is that people have decreased addiction behaviors in the beginning. Also, these medications, especially when they are first started, can cause nausea. And so people just don't feel like putting anything in their mouth, even water sometimes. So we have to encourage our patients to even stay hydrated. But after a while, when it really is an addiction, I kind of see patients falling back into their their addictive patterns, even with these medications on.
And there's also something about maybe reducing screen time. I don't know if that's correct or not.
Yeah, I don't know. I haven't really seen that. It's very interesting though, because I don't know if it's just that people feel very controlled by food, but I have had many patients just feel like these medications are freeing them up, like they're freeing up headspace. They just feel like almost a new person and a more productive person on these medications because not as much time is spent thinking about food and kind of a lot of people are actually addicted to food, so that kind of reduces. And so yeah, I've seen a lot of like not the effects that we were going for, but positive side effects that are happening from the meds.
What are some of the negative things you've seen?
Yeah, so like I mentioned, the most common side effect of these medications is nausea. It's pretty common in the first 3 to 4 weeks of being on the medication. It typically subsides with time. So what we do with the medications is we start people really low to kind of acclimate their bodies, like Ozempic or semaglutide. We started at 0.25 milligrams, which is not even really that effective for blood glucose lowering. For some people, it is tremendously effective for appetite suppression. And then as the patients kind of get acclimated to it and they're not having those symptoms of nausea, we kind of slow step it up. That's the most common side effect. But, people do have really bad side effects sometimes, like profound nausea, vomiting. There have been some reports of like ileus, or people's bowel basically stops moving from these medications. There's like a class action lawsuit going on related to gastroparesis that wasn't originally seen in the early studies. So these are very severe conditions. So it's really important to screen our patients properly. And only give it to patients where the benefit outweighs risk. It was just a couple of years ago that like the world went crazy about these medications. And so since then, we've been seeing a lot more adverse effects because patients aren't being screened properly, or the dosing isn't right because they're a little bit complicated in dosing. People aren't being seen by providers. There's like prescription mills for Mounjaro and Ozempic. You call a number and you can get a prescription, and God knows who's filling it. And so the reported adverse effects has just skyrocket too. And like the New York Times is writing about it every other week too. So it's just so much more attention on it and so many more people asking for it. And also like there's a ton of compounded formulations that are pretty scary out there too, that we don't really know what's in them. That's also they're having adverse effects from those too.
So we know the drugs have been used for diabetics, and now more recently there's been the weight loss approval. Do you feel like that has also kind of increased the frenzy and people talking about it more and wanting to get it prescribed?
I really think it was social media, because Saxenda, which is the brand name for Victoza or liraglutide that was approved for weight loss, was approved a long time ago, like before 2017. And so nobody was talking about that. And then semaglutide or Ozempic, or the brand for weight loss is Wegovy, was approved in 2021. I want to say January of 2021 is when the NEJM article came out about it. And it wasn't until like late 2022 that people started going crazy over it, after like Elon Musk said he was on it and some other like really famous people. Um, so I don't know if it has to do, like, obviously the FDA approval has some part to play in it, but I really think it's been social media.
How do you think this is going to affect some of the economic structures that are based in the weight loss industry? So, first thing I want to ask about is bariatric surgery. What do you think is going to happen to bariatric surgery?
I think this is a really interesting question. And the reason it's interesting is like we can have bariatric surgery like outcomes as far as weight loss with these medications. Like I'll tell you, I've had patients lose more than 100 pounds on these medications. Several patients lose more than 50, 60 pounds. So tremendous amounts of weight loss. And without the burden and risk of surgery. And also, without bariatric surgery has a potential for a lot of complications, nutrient malabsorption. Patients really have to be good about follow-up and making sure they're taking their supplements. Otherwise, they can run into a lot of problems. And we usually, as endocrinologists, are the one managing those. So we have seen those a lot. So I think the GLP-1 receptor agonists are a much nicer option for patients for a lot of reasons. The problem is coverage. So coverage for obesity medications is really bad by insurance. And so patients are having to pay out of pocket oftentimes for these medications, and they're really expensive, like $1,000, $1,200, $1,400 a month. It's just not feasible for a lot of people. Whereas bariatric surgery is still better covered for people who are like very obese, which is really sad. It's obviously a much more expensive, less safe option. So I hope that that changes. And I know there's quite a bit of lobbying to try to change that. It has to do with Medicare law, but I think it's kind of going to be a slow roll, like anything that requires policy change to improve coverage of anti-obesity meds.
Yeah, they cost what, like $1,000 per injection?
So $1,000 a month usually. So usually that's 4 injections.
Like, what are the trends that you're noticing with coverage? Like, are commercial payers better covering it, or how does this get covered for some people?
So for weight loss, it's not well covered. The places that we have the best success are forward-thinking employers that recognize, I mean, the AMA classifies obesity as a disease. But culturally, for some reason, we don't. We blame it on the patient. Like nobody really thinks twice about having a blood pressure medication. Nobody's like asked, do you deserve that medication for high blood pressure? But when it comes to obesity, there's so much of stigma involved in it. Patients are called lazy. There's a lot of bias towards obese patients. And so the mindset really has to change. But, the same lifestyle factors cause heart disease and hypertension that cause obesity. So it doesn't really make good medical sense that we have this bias against people living with obesity, but that's where we are. So employers that are self-insured, the employers that actually we serve, who actually think innovatively and can understand the long-term cost of obesity, and who care about their employees and care about employee retention and want their healthcare benefits to help them with employee retention. Those are the companies that are the ones that are covering really well. Like here in Houston, ExxonMobil has pretty good coverage for weight loss medications. HEB is another good employer in Texas that I think has pretty good coverage. But usually these are self-insured employers that determine their own plan specifics.
Hi, everyone. If you've enjoyed this interview thus far, be sure to hit the like and subscribe button below. It not only helps the channel, but helps out all the people that we interview. Thanks for watching. And just for anyone who's watching who doesn't understand what a self-insured employer is, it's basically, my understanding of it is it's basically a massive company that keeps their healthcare insurance in-house and doesn't contract out to a larger payer.
It's actually not just massive companies. Like we have a self-insured group that has like 200 employees. So they don't have to be massive. And actually 60+% of employers in the US are self-insured. So it's not as uncommon as we think. It's just not how we traditionally think of health insurance. And basically how it works is companies have figured out that when they're paying their employee premiums to Blue Cross, United, Cigna, and Aetna, they are paying increasing in premiums every year, but the value keeps going down. So what self-insured employers have figured out is if they can pay that premium to a pot of money and then just pay out their own claims and have administrators that actually work in their benefit, they can save a lot of money doing that.
What about industries that are focused on, just weight loss in general? Do you think it's going to affect like their earnings, how they operate?
I have so many thoughts on this, first of all. So, a lot of companies are trying to get into the GLP-1 space. Like, there's a bunch of companies trying to integrate GLP-1 receptor agonists into their nutritional platforms or their coaching platforms, because they're very effective for weight loss. I think we're gonna towing a fine line of like the safety of this, because when any medication gets prescribed in mass quantity by non-experts, like there's obviously potential safety ramifications for that. And also, if it's prescribed in mass, the counseling around the medications, the monitoring for adverse effects, all of that stuff is going to plummet. So while yes, I do think more people need to have access to these medications because obesity is just rampant in the world and the US. I do think we need to think about it safely. I also have seen like a lot of concern, and I'm frankly concerned about this too, about there's everybody selling their kind of weight loss plan or their weight loss program, and they're showing before and after pictures. And there may be some unethical folks out there using GLP-1 receptor agonists and not reporting that and selling a program that doesn't have it, getting these, incredible results. And there's a lot of snake oil sellers out there, and this is like a tool that can facilitate that if people aren't honest. I do think this is revolutionary for weight loss as far as health, and for businesses. I think there's a lot of room, and there already has been a lot of like kind of unethical ways it's been used. But my hope is that we can find some really great ways to increase access to these medications. Cost is going to be a huge part of that too.
That's a really interesting point about people that may be selling a weight loss program, but not disclosing that they're also using something like Ozempic or Wegovy. So I didn't even think about that.
I mean, I've seen so many things on Instagram and even people in the community who I'm like, they're saying that they changed this nutrition thing, but they had such tremendous weight loss that I'm like, I'm pretty sure you're on Ozempic. Like it's just the amount of weight loss people are seeing with these medications is more than we've ever seen before with really any other lifestyle intervention. And I think a lot of people say, well, the like biased perspective is, well, people could just do this with diet and exercise. And studies have actually shown that no, like we do like side to by side studies where people on placebo doing the same lifestyle interventions and like having a coach and having support and all of that stuff, they don't lose the weight. So these medications work very well in the right patients.
So with bariatric surgery, a lot of times patients who lose a lot of weight also end up needing or wanting to have some sort of plastic surgery to take care of excess skin. Do you see that happening with these drugs as well?
Not really. I haven't had very many patients complain about the loose skin. I certainly have had a few. One thing with bariatric surgery is the patients are usually, very, very obese when they have bariatric surgery, and they lose weight very, very rapidly, just because of the nature of the surgery and also the diets that's required from the surgery. And so I think that probably those two factors probably lead to more of that loose skin issue than perhaps GLP-1 receptor agonists, that it is fast rate weight loss, but it's not like, as rapid as bariatric surgery in most cases. And also they may be started in patients who aren't as severely obese as those who would be going for bariatric surgery. It is there, but it's not as frequent with GLP-1 receptor agonists in my experience.
What percentage of the population do you think is going to be on this once coverage improves?
Oh, this is a great question. So, like 30+% of the US adults are obese. So, there's a lot of people who could qualify if coverage improves for obesity. And then, people with overweight and comorbid metabolic conditions like coronary artery disease or diabetes or something like that, they would probably qualify at that point as well. It's actually guideline recommended for people with pre-diabetes. That's another 30% of the population. So it's really, really widely recommended. Do I think all of those people are going to end up using it? No, of course not. But there's going to be a lot of people who maybe don't meet that criteria but want it for other reasons. So gosh, I think there's going to be a lot. There already are a lot of people on the drugs, even more people wanting the drugs. So I don't know. It could be like 20%.
All right, this has been super interesting. Thank you so much for all your insight and knowledge. Any final thoughts on these drugs and where you think this industry is going?
Thanks so much for having me. Yeah, so I think the most important thing is if you're thinking about using these drugs, really talk to somebody who knows what they're doing with these drugs. There's a lot of avenues for getting these drugs now, and many of them aren't very safe, especially in the compounded space. I mean, I had my allergist friend let me know just a couple of weeks ago that she had 2 patients coming in with anaphylaxis on compounded semaglutide. We don't know what's in it. So these drugs can be really helpful. They can be very effective. They can really be life-changing for a lot of people. But I really encourage you to engage with them in a safe way, talking to a specialist, seeing a real doctor about them. I think there are going to be tremendous economic benefits of these medications. And I think now that the eyes are on them and are on the pharmaceutical industry and the health insurance industry, my hope is that means that the medications will come down in France. I mean, Ozempic costs 80 something dollars a month in France, and it's $1,000 here. So there's a lot of price disparity here in the US that we're struggling with due to our non-transparent healthcare system. So that's my hope. And I think the prices have to come down.
There are people right now that are booking flights to Paris because of what you just said. I'm like, wow, that is crazy. $80? How do they do
Yep.
that?
Yeah. Oh gosh, that could be a whole nother
Yeah,
podcast,
that's a whole
but
other conversation.
yeah, it has to do with the way the pharmaceutical industry is regulated here through PBMs and things that increase pricing. Yeah, you can actually go to Mexico and get it for cheaper too. So you don't have to fly all the way to Paris to get it for a
Paris.
much better price.
Yeah, I totally agree with your statements on making sure that you're getting it in a safe manner. We know that when a lot of drugs become readily available, there's a lot of, healthcare startups that will just start. Make sure you know where you're getting your drugs from and that you've been properly evaluated for the medication. Dr. Thangudu, thanks so much for being here. And I know you also have a YouTube channel where you talk about diabetes. Can you tell us what that is?
Yeah, it's just Arthi Thangudu MD on YouTube, and we talk about diabetes, thyroid issues, and all sorts of hormonal conditions.
Awesome. Thanks for being here.